Debbie, just wait a few minutes till the participant number gets to maybe 40.
I can't see that, but
Okay.
It's fine. It's going up relatively quickly. We're at about 25 right now.
Okay, you can start.
welcome everyone to our 6th ASAP webinar series for USAID PEPFAR local partners. I am Debbie Khalil in USAID's Office of HIV/AIDS in Washington, D.C. And we're thrilled to again be hosting a webinar for you all. As many are aware, this webinar series is focused on supporting our PEPFAR USAID local partners in award management and reporting and sharing lessons across the globe on how to do this for successful award management. But today we are focused on business continuity during COVID-19, recognizing that the COVID-19 pandemic has hit us all and we're all figuring out ways of coping and still delivering on our programs. We thought it would be very useful for a focus session on business continuity. We hope to continue to do some particular topics related to COVID-19 as we go forward as well in this webinar series, but those will be announced at future dates. The webinar series is put on by ASAP. It's a central mechanism out of our USAID Office of HIV/AIDS in Washington. The focus of the project is building capacity for local partners implementing PEPFAR programs, and this series is one of the key activities in in the scope of work of ASAP. So to start off, we wanted to share just a few lessons, or a few resources and updates from our office. To start, just to share the agenda for today, also opening remarks, and then we're going to have COVID-19 business continuity planning and guidance for local partners. This is presented by Jennifer Mueller from the Achieve project. Then we'll have financial analysis in COVID-19 era presented by Fasira, advisor in Ethiopia. And then experiences from a local partner during COVID-19 from one of our projects in the Foundation for Professional Development in South Africa. We wanted to share our schedule for future webinars and highlight we have one that's confirmed for May 6th, also coming up quite quickly on USAID vouchers, liquidation, cash advances, burn rates, and cost sharing reporting. And you can see other topics. These all have been informed by input from you all in surveys. So please continue to let us know if you have topics you would like to hear more about, and we will adjust these and tweak the schedule as we go forward. After May 6th, these are still tentative and being confirmed, but keep in mind all of these topics are ones that you told us you'd like to hear more about and we're preparing to share. We also have a plan for webinars in French, recognizing that we have local partners that feel more comfortable in the French language. And so we are working on developing this schedule for those who would prefer these in French. We wanted to also highlight that on Thursday this week at 11 a.m. Eastern Standard Time in the US, we have a call for the USAID Office of HIV/AIDS with our implementing partners for PEPFAR. This is an important opportunity to hear directly from our office leadership and to hear the latest on technical and programmatic updates related especially to COVID-19, but other topics as well that will be of interest. So please plan to join this if you're available and able to come. We also wanted to highlight USAID implementing partner solutions. These have been calls that have happened over the last few weeks. Sorry, I have a toddler. I'm going to move to another room. These have been...
Aww.
Sorry, 1 second. These have been calls happening over the last few weeks focused on solutions for dealing with COVID-19, and particularly how it relates to our HIV programs. These are not official guidance from USAID or PEPFAR, but opportunities to hear from other partners of how they're responding to COVID-19. So you see a few coming up next week and the following week. And then there also have been 2 already done, one on decentralized drug distribution and one on community and social distancing. If you're interested, they were recorded and you can see the slide decks and notes there attached to. And as hopefully people are aware, the State Department Global AIDS Coordinator Office has been releasing updates on their website every Wednesday and Friday on coronavirus or COVID-19 and their latest official guidance. And you should be checking that website to see what's coming out on Wednesday and Friday on a regular basis. You can see a couple of the updates that have happened recently. And finally, we wanted to share some other resources that are out there from others beyond USAID and PEPFAR. These are all important links that you may already have, but just in case, here's a rack up of some that we have been tracking. And before we turn it over to this session, I wanted to just remind us, we did a survey, ASAP conducted a survey that you all provided input in before our last webinar series in late March. And I wanted to just remind us of what we had heard from you as we framed this session for today. So the survey was conducted in late March. So of course the latest data has changed and shifted. But at the time we heard from 18 countries, about 60 people responded. And we heard on average there were 36 confirmed COVID-19 cases in countries, but some had 0, some already had over 500. And again, of course, these are now quite outdated a month later in terms of the number of cases. You can see the response rate across countries. So we heard from a wide range of countries in the survey. And heard from you all what governments had done thus far in terms of responding and closing things down in country. Many had closed down schools and large gatherings and other things not specified, and some had closed down borders. We noted that many of the partners who responded had their office had made changes. Over 65% had already made some changes in operations due to COVID-19. And close to 30% had most staff working remotely, with a few, also 20% with just a few and 18% with some. Still at the time, some had not done anything differently, but recognizing again that this was about a month ago, I'm sure these numbers might look different at this point. Many also were still continuing to do community outreach activities, although some had started to shift those and were moving to a different kind of approach for community work. And many had safety measures in place like hand sanitation, although still there was few use of sterile gloves or face masks in use. The other category included hand washing, temperature screening, and in some cases, none of the above. So that's my final slide for background before we start this presentation. We're really excited to have some stories to share from our implementing partners of what they're doing to think about continuity planning and business continuity in this time of COVID-19. And so I will turn it over at this point to Jen Mulick, who is going to share what Achieve has done, a project, also a central project out of the USAID Office of HIV/AIDS, implementing in many countries around the world. Jen, I will pass it over to you.
Before we get to Jen, can I just point out, this is Catherine Brokenshire Scott, the project director for ASAP. I'd like to direct all the participants to the question and answer icon at the bottom of your screen. If you put in your questions while we're proceeding with the presentations, we will stop periodically and answer them. Thank you. Over to you, Jen.
Okay, good morning, good afternoon, everyone. Can you all see the screen here with the COVID-19 business continuity planning guidance?
Yes.
Okay, great, great. Well, thank you so much, ASAP, for having me today. My name is Jennifer Mulick, and I'm the project director on the Achieve project. We have two objectives on Achieve project. One is to attain and sustain epidemic control in priority populations, including children, adolescents, and pregnant and breastfeeding women. Our second objective as a project is to build the capacity of local partners so that they may receive direct funding from USAID. So some of you here on this call we already work with, and some we may be working with in the near future. So thanks again for having us. We put together as a project the business continuity planning guidance because we saw a need for many of our local partners to have an easy guide to guide them through how to communicate and how to set up their business operations under COVID. You know, we wanted to make sure that we could get our implementing partners to feel at ease as possible, you know, during these very difficult times when you have to make quick decisions. So we put together, see if I'm advancing the next slide. Okay. I just hit the advance button and it didn't go anywhere, Catherine. Let's see.
Jeff?
Yes, so try using the arrow key and
Okay.
just, and if you have two screens, sometimes if you've taken your focus away from PowerPoint, just kind of click on the PowerPoint screen and then use the arrow.
Oh, here we are. Okay, so the next slide is about why the business continuity planning is important. It's important to have a comprehensive plan to manage your activities against the risks. You want to make sure that your staff is secure, that your volunteers are safe, and that they feel comfortable either continuing with their work or doing work in a different way. Also, defining the communication mechanisms is a very important aspect. You want to make sure that your messages get to every part of your team and to all of your stakeholders. So I'll go through some of the stakeholders that you may want to communicate with on a next slide. It also enables coordination across various units. You may have field offices in another location. You may have another unit that's on another location. You may have M&E collection people who are based out in the field. So you want to make sure that you can communicate across all of the units in an organization. And importantly, having a business continuity plan facilitates the preparation for restarting activities post-crisis. When you have shut down in a very systematic way, then you can tick back up with your activities in a systematic way as well. Also, it allows you to work with any sub-grantees that you may have and give them also kind of a management plan and security of knowing that you're still available and they know how to communicate with you. So the resources that we put together, the first is a step-by-step 10 considerations for business continuity planning. I'm going to go over an overview and then I'll go through each of the steps during this presentation. We also, the second bullet there is actually a PowerPoint. So it's a training and an orientation module on business continuity planning for local partners. And then we have 4 customizable templates that you may just take and use. One is the actual plan itself. So it has spaces and tables for you to fill in information. It's got a designation of authority system so that in case you have some staff who are not able to work, who would be acting for them and how to get a hold of them. Also, the activity continuity plan is incredibly important, and I know many of us have been submitting those to PEPFAR and to USAID so that they know which activities we are able to continue, how we're doing that, and which activities that we may have to curtail, you know, those ones that have more than 10 participants. as well as a simple phone tree so that not everyone has to call everybody else, but it's a very systematic way. And phone trees also should be tested, which is what we did here in DC shortly after the COVID quarantine started. So I'm going to go over the 10 considerations for local partners. So these are laid out here, and this can be kind of a quick cheat sheet for you. The first is to convene a task force. You don't want everybody participating, but you do want people who are decision makers and who are able to cut across the activities that you conduct as an organization. The next thing is developing the plan. You put together the plan. As I said, it makes the organization more manageable under certain quarantines that you may have, or stay-at-home work order or stay-at-home orders. And also it allows for you to be able to refer to it. And one of the very first things that you need to do after you develop the plan is to reach out to your donors, making sure that they know that you are still available and what activities you're able to conduct. Of course, following host country government guidance and heeding those warnings are incredibly important. I'm going to go over later in the presentation the different stages we are at with some of our implementing partners in different countries. Of course, you want to enact those precautionary protocols, hand washing, and other hygiene. Of course, communication is paramount, and we will go through the various tools that we have for communicating. You will check your insurance policies and conduct a financial analysis. And finally, making programmatic shifts so that you are able to do as much as of your work as possible. People are going to be extra vulnerable during this time. So you want to make sure that you're able to reach those most vulnerable, but in a safe way for your staff. And finally, remember your mission. I know there's a lot of information coming around to you and through you on a regular basis, but you have to remember your mission as an organization, whether it be HIV treatment or DREAMS funding or working with vulnerable families. It's important to remember your mission so that you know you will be able to start up in the near future. So going through the very first slide on convening a task force, it is important to have executive leadership on that task force so that the decisions may be enacted. You're going to want to have your CEO or presidents and maybe someone from, excuse me, your board of directors. As well, human resources is incredibly important. They will be able to determine what types of benefits you have for your staff and also other ways to keep them safe and secure. Finance, of course, financial planning is one of the most important parts, and we do have a special section on that later in the presentation today for you all. Your security and travel management is very important to be part of the task force. They will be making decisions on whether or not travel is safe domestically or internationally. And I know that, you know, as an organization, we at PACT made decisions to curtail travel in a stepwise process. So this is something that will be evaluated and reevaluated. So it's important to have that person on the task force. And as well, you will want to have technical program management staff. You do want to consider some secondary response teams at different levels, depending on the size of your organization. If you are countrywide or in many countries, you want to have them in different countries as well. So the scope of a task force for COVID-19, it'll be a central decision-making and coordination body for your response to COVID-19 as an organization. It's also going to lead communications with staff and stakeholders. You may get many people calling in asking about what your policies are, if you are still going out into the field, whether or not you're going in the field. You may have government calling you, you may have stakeholders or beneficiaries. So this is a way that you can have communications be clear and uniform. The scope is to guide your business operations while you either scale down or scale back up. And then, of course, you have to decide how that task force is going to meet, how often, and what type of mode of communication that you decide to use. Some people are happy with Skype. A lot of us like Zoom, and we're getting to like it more and more every day during this quarantine, or even a simple WhatsApp group. And then you're going to want to document those meetings with minutes and share the updates from each of the meetings with your staff. It makes them feel more secure to know that the leadership is concerned and considering what's happening during the pandemic. Next, you want to develop a plan. And developing the plan has different stages. So you may have 0 cases in country and your government may not be shut down at all. So you may have business as usual. You may go into level 1, 2, or 3, and there will be different event markers or triggers for that, considering like community transmission of COVID. When that begins, a lot of the countries have been starting with remote work encouraged. And then at the highest point, you'll have remote work mandatory. And obviously that's where we are in many places in the United States right now. And you may be as well. So the documents, developing the plan, it documents why you made the decisions and what the triggers were for that. So it does create stability and guidance. And then obviously you're also going to be scaling back up. And so it provides you that flexibility to respond to changes and to open back up when the pandemic subsides. The elements of the risk scenarios you can see on the right, and this is part of the business plan template as well. So you will see the elements of the risk scenarios in this table, and the table is in the template that we will share. So when you develop a plan, what should be included in the plan? Again, we do have a template for this. So the first thing that you want to look at is budgets and operations. We're going to talk about that a little bit later during this session, but you want to look at budget scenarios and costing out of your COVID-19 activities. These may be increased travel, decreased travel. It may include more airtime for volunteers or even for beneficiaries. And you're going to want to update your monitoring and management processes for your local other partners that you may be subgranting to or working with. And then, of course, you need to manage your cash and financial approvals. And those are largely going to end up going virtual if you do have everyone working from home. Program implementation, of course, supply chain is going to be interrupted during this time. So one of the major activities that USAID and PEPFAR are looking at is to ensure that your HIV positive beneficiaries are able to access their ART. And so looking at supply chain options for that and supply chain options for other things like even airtime and if you need fuel for emergency travel or all of these other things that you will need in supply, you'll need to look at your options. Updating your activity plans. I know many of us have already had to do that and submit them to our AOR. Guidance on COVID-19 prevention and response. You want to put that out to your beneficiaries and to your staff to ensure that they are aware of good hygiene practices, both hand hygiene and respiratory hygiene. I know Suzanne is going to talk about this more in depth and their experience with FPD in South Africa. Next, the next part of your plan will be a communication strategy. And that will be an internal communication strategy and external. So you'll be identifying your key stakeholders, the messages that you want to get out to them on a regular basis, and how you are going to do that, whether that's website, press releases, or social media. This is when your communication department becomes incredibly indispensable. As well, it's important to just manage your staff. And if you are going remote, you want to have work guidance on remote. You want to set up regular meetings with your direct reports and how you're going to do that and when you're going to do that. As well, your IT Your IT staff is incredibly important at this time. They're going to want to ensure your document storage and your backup. Travel management processes have to be set up for HR and administration. I mentioned this earlier. And then designation of authority and staff care, including the management of any COVID-19 cases in your offices among staff. Okay, so we included here a screenshot of the business continuity plan. This is the sample template for you, and you'll see the highlighted sections. We have instructions on what to include in these. You just put in the names of your task force representatives. You look at your criteria and triggers, which could be different in every country. And then you go through and submit all of the different sections on how you're going to communicate. And there's several other pages. This is about a 7-page template for you. Okay. So I did mention that reaching out to your donors is very important. They're going to want to know how to get a hold of you during this time, and they're going to want to know what you're doing. So it's important to make sure that you also reach out to your subgrantees and communicate to them about what is allowable and not allowable as far as activities are concerned during this time. And then, of course, you may have other funding, not just USAID funding. And so you'll want to reach out to them and make sure that they know how to reach you and what activities you're able to continue and which ones you're going to curtail. Also, it's important to alert them if you anticipate any changes in your timelines and reaching your targets. I would imagine that all of you with PEPFAR funding are aware that your targets may be affected, and as you're implementing and doing your best to still reach those targets, it's still good to discuss that with your AOR so that they're aware that there may be impact on your achievement of targets. You'll want to discuss if your office is open or closed, and either if the sites are open or closed. And then very importantly, you're going to want to receive approvals in writing for any work plan or budget changes before you start implementation. So if you're going to do activities that have been talked about and that you'll see probably more presentations on in the near future, you're going to want to get implementation, before you implement, you're going to want to get approvals from your AOR. And then also you'll want to follow the USAID and PEPFAR OAA COVID-19 guidance. And we have a link to that here on this slide for you. It's absolutely imperative for you to follow your host country government guidance. I know in many countries, they even have some curfews that are being enforced. So first and foremost, follow the host country guidance on what is allowed to be conducted and what is not allowed to be conducted. You'll want to monitor communication and guidance from national and subnational government authorities. I know in places in like Nigeria, the different states have different travel policies, and so you'll want to monitor it subnational as well as national. They're going to definitely have communication on limitation of how many people you can gather together. So some of the ways that you do business may need to be rethought so that you may still be able to conduct some of your activities. Schools are going to be closed, as I saw from your survey that you did earlier. Most countries have a lot of school closings. There are definitely travel restrictions, and then there will be impacts on the health system as well. We are seeing some of those in the US and around the world, and we're also going to have to make sure that we are able to understand where to refer our beneficiaries to if health systems, some are closed and some are open. You'll need to want to communicate about what social welfare services are still open and able to be accessed. I mean, these could be gender-based violence or child protection facilities. So you'll want to talk about that. You'll want to be sure that you know which ones are open. And then, of course, talk about COVID-19 prevention and precautions. And as I said, Suzanne will discuss those more in depth. You want to share these government guidance and warnings with staff and with partners, and adjust your programming to be responsive to these guidelines. So the precautionary protocols, this mainly has to do with physical distancing. Having a remote work status for staff, you're going to have to establish accountability mechanisms so that if staff are working remotely, you check in on a regular basis. And checking in means that you may need to purchase airtime, additional airtime for staff. And then as well, staff may not have computers at their home. So you are going to, while you are deciding whether or not to stay open or to work remotely, you will want to sign out various work tools like computers and other office equipment, so that when you start back up, you can track those supplies. So managing the sign out of the computers in a proactive way is important. And then, of course, you may want to look for different pointers on productivity, setting times for self-care during the day, and then also making sure that you are available for important calls and that you've blocked that time off. And then, of course, just giving people some latitude because of the stress that they're going through. If you're working in an office, you are going to want to establish criteria for your essential and your non-essential personnel. Some staff may be able to do their job from home. Some may need to be in the office or even the facility, the healthcare facility you may work in. Limiting meeting sizes to less than 10 people is a very smart idea. Holding meetings in open air environments and limiting visitors to the office. When you are standing down staff, when they're starting to work from home, you need to communicate clearly on who needs to be at the office and who needs to be, who may be working from home. You want to talk to the staff about what their benefits are, what they're entitled to, what salary they're going to be getting. This also puts everyone at ease if they are going home, that they know they have a job to come back to. And then you need to review your employment agreements and the legal requirements country by country and refer to your personnel manuals. The cautionary protocols, like I said, we're going to have Suzanne go through those a bit more, but you'll want to establish your hygiene and office environmental cleaning protocols. Make sure that you have hand washing facilities and hand sanitizer, and coordinate with office access. Some offices will be completely closed, and then if they need to be accessed, they'll have to get permission from the task force. I wanted to mention here too, we have 2-page fact sheets in English and Spanish and French for what community volunteers should know about hygiene and doing their work in the community. So we can make those available to you as well. As I said before, communication is tantamount during this time. The mechanism is very important. We need to know how we can connect, as well as we need to gather phone numbers. We may not have had phone numbers in the past for all of our staff. Phone numbers for beneficiaries we've been seeing is incredibly important in order for us as an organization to do our work with orphans and vulnerable children, because if we have the beneficiary, the caregiver's telephone number, we can do case management over the phone. So that's been effective for us so far. You also want to have email addresses, and you'll want to set up virtual team meetings. This also does help with, if you can do them with video, if you're able to do them with video, it helps to be able to reach out and connect to your team. And it creates a feeling of camaraderie as you're going through this difficult time. And then, of course, you want to schedule individual check-ins, and you want to make sure that your communication is clear through social media, press releases, and websites. Some of the key messages here I am laying out, and this is also in the business continuity plan template. The key messages and your audience here, you can, when you're putting together your communication plan, you can decide who gets which messages. So the guidance from government health authorities should go out to all of your stakeholders. Updates on the work of the task force should go out to staff on a regular basis. So not everything needs to be communicated to everybody, but you do want to make sure that you have the right audience getting the right information. And then of course, update this on a regular basis about service delivery site closures too. Getting that information out to beneficiaries is incredibly important. We do have the trust of the community, and if they go to a site and need services and aren't able to access them, it will deteriorate some of that trust. Making programmatic shifts, this part can end up making you busier than you are under normal circumstances. So there's a lot of COVID-related programming that can go out during this time. The first, of course, is prevention messaging for volunteers and beneficiaries. Contact tracing, because a lot of our partners work very deep into the community and they are able to do contact tracing easier than others. Of course, you'll need to communicate whether or not that's something that you have the capacity to do as an organization. Information about access to testing and health facilities, special measures for PLHIV and other vulnerable populations, referrals to gender-based violence prevention, and also multi-month dispensing of ARVs is incredibly important for all PEPFAR programs. Psychosocial and adherence support and follow-up via phone will assist people to stay on their ARVs. And the use of PPE is not actually being supported, but if it's available locally, you may be able to find PPE of different sorts depending on which level you're delivering services at. There are other programmatic shifts that you need to make, having physical distancing, like I said, having open air meetings, and shifting completely to virtual or phone-based service delivery. This is an interesting challenge for us, and we will be able to look at this after everything subsides and maybe see how much more work we can do phone-based. I think that our community volunteers in general are able to reach out on a regular basis and do a lot of their work by phone. So this may save money in the future, actually. And we have to anticipate and plan for the potential supply chain interruptions. And then of course, we need to do COVID-19 related data collection. If you are performing activities that are related to COVID-19, you do need to record those. And we do have some indicators that we can share with you. You'll want to look at remote data collection, data quality assurance systems, and then virtual data review meetings with the pertinent staff. So next I'm going to go into some of the examples that we've had so far and the feedback that we've gotten from our different buy-ins. Achieve's largest buy-in right now is in the Dominican Republic, and they're in the Western Hemisphere, and unfortunately the COVID-19 virus hit them very strong and very quickly. So it shut down very quickly. There are curfews in place from 6 p.m. to 5 a.m., I believe, and the OVC service delivery was shut down. We're able to restart service delivery, especially for emergency cases. And we are doing some distribution of food along with World Food Program. We've been able to do COVID prevention education, counseling and referrals, and phone-based case management. Those essential case managers, the essential household visits that are occurring due to either violence against children, stock out of medicines, or other urgent situations, we're able to get the community case managers out to assist the beneficiaries. We're ensuring a supply of ARV for all people living with HIV. And as I said, we have various food support and hygiene kits that are going out. And there, we have had to purchase additional airtime for the community case managers. So this is the most restrictive we have so far. In Nigeria, this goes, we work in 3 of the ICSA states, and they have closed their borders and they've enacted social distancing and hygiene precautions. However, some of the requirements are different state by state. And so we have been able to get out some household visits, but they're having social distancing. So still going out into the community, but staying 6 feet away, not going into beneficiaries' households. And then we also have instituted our phone-based case management and done some remote training. We're using local car hires for transport of supplies, and we're liaising with the government of Nigeria to procure PPEs for our community case managers. We're making sure that we have our CCMs credentialed so that they are able to move about and are not affected by the lockdown. And we're increasing incentive to CCMs to cover some of their extra expenses for travel and service provision during this time. The least restrictive is Burundi. They have very few cases in the country. The operations are continuing as normal with some social distancing and hygiene precautions. We're continuing our case management and small group activities, making sure that we have education and counseling on COVID prevention integrated into those. We have increased WASH education and even talked about ways to improve hand washing stations. And then we're preparing right now for the initiation of phone-based case management in case we need to do that in the near future. So this may not be the most engaging thing to do at the time, but it's very important to check any insurance policies that you may have. There are varied staff benefits during this crisis. Some testing may be free. You may have some coverage for your actual office if you have any loss of property, if there's any civil unrest or otherwise. I know there have been demonstrations in the US, and we are thinking about that too with our US office. And then coverage for loss of business or standing down activities. It would be good to know if you are eligible for any of the benefits that your government may be making available. Conducting a financial analysis. As I said, we have Fasika, who is going to talk us through some of the considerations for your cash flow, your financial reserves, and for remote financial reporting and banking processes. So he will take us through about 7 slides on that after my presentation. One of the things that you're going to have to do is digitize your timesheets. So you're going to want to put these together in an Excel. We have a sample here that we're able to share with you, and you'll need to make sure that these can be submitted and approved online. Finally, if you do have staff and volunteers, you're going to want to make sure that you're able to transfer via mobile money or direct deposit salary or incentive payments out into the community. You may have set these up already, but you'll want to confirm that these are still active during this time. And as I mentioned earlier, we do have some materials for community volunteers. We have a fact sheet in English, French, and Spanish. And so that's a 2-page fact sheet about what volunteers should know when conducting household visits. We have an orientation for community volunteers in English and French. That is a PowerPoint presentation with very simple information about the COVID virus. You know, our populations are affected by HIV, so it's pretty quick to be able to explain what a virus is. However, COVID is a different type of virus and a different way of contracting it. You want to look at the different signs and symptoms, the risk factors, how to prevent, and good hand washing and respiratory hygiene. Finally, we also do have a list of data collection tools for OVC programs if you are interested under COVID-19. And finally, I want to share, to make sure to remember your mission, the work that we do is incredibly important. It's, we deal with some of the most vulnerable populations, and at this time, they're going to become even more vulnerable. So in order for you to put together a business plan, you need to think about the people that you reach on a regular basis and how you'll be able to start up again after this COVID pandemic and be able to reach those people that are so important to your mission. So I thank you for your attention, and for any questions, feel free to reach out through the chat box or to me later. I've included my email and our AOR's email book on the last slide for you.
Thank you, Jen. That was really well done. We got a lot of comments saying thank you for the information, and can they get the slides? And so I just want to share that I've sent the slides for all the presentations to everyone on our listserv. So if you did not receive them, there's a email in the chat Q&A box that you can go to ask for the slides, just in case you're not already on our listserv. We do have one question, Jen. Is there anything a sub-grantee can do? It seems this information is for prime partners.
I think that the sub-grantees can take these business continuity planning tools and do the same thing. Not everything will apply to them. You know, some of the planning for HR, especially if, you know, they have mostly volunteers, it may not apply to them. They may not have the same type of insurance coverage, but they can go through the steps and everything can apply to them as well.
I was thinking the same thing.
Yeah.
And I see we have one participant with their hand up. Mavis, if you would like to put your question into the chat, into the Q&A, I mean, then we can answer it. Okay, so there are next.
Catherine,
Yes?
I just want to reinforce what Jeffrey mentioned on the application of, you know, these principles to the FFA holders, particularly in our context in Ethiopia. You know,
Afrik, you have two connections going on, so you're echoing a lot. So I think what you want to answer is the question on how does this apply to fixed award amounts, which
Yeah,
fixed award amounts have a deliverable and a set amount of money.
yes, I just wanted to supplement, but I think there is some echo here.
And this is Debbie Cleel from USAID, and I know that's a particular situation for Ethiopia. Other partners may have something similar, but for those partners, it's really important to communicate directly with your agreement officer and your AO and your AOR in Ethiopia. And I know they have guidance coming out. We were just checking with them to see when that'll come out, and it sounds like momentarily they'll be sending information directly to you all with how to deal with your FAA particularly.
Okay, and I see a lot of people have said that they haven't received the presentations from Nomea. Hi, Nomea. We will keep, if you haven't received them, please put your email into the Q&A, and Grace will make sure that you get included in our listserv and you get all of the presentations. Thank you. I don't think there's any more questions right now. There's one new message. Let me go read it. Okay, that's fine. So Jen, if you could stop sharing, and then I will share my screen and introduce Fasika Arega, who is the ASAP Capacity Advisor for Financial Management in Ethiopia, and he will do a presentation on financial analysis. Over to you, Fasika.
Okay, thank you.
Okay, you're going to need to only have one connection to Zoom, so you and Afric need to turn, Afric, you need to turn off whichever connection you have because you're echoing a lot. Okay, go ahead, Fasika.
Presentation. My name is Fasika Raga. I am from Ethiopia Project. Yes, would you please move the next? Yes. During this COVID-19 time, it is very important to conduct a financial analysis to properly manage our budget and activities. We are working from home, and this financial analysis at least needs to include identifying and planning new costs that may arise in connection with this COVID-19. And if applicable, we can plan our financial reserves for emergency situation. And in addition to this, it is very important to review our cash flow in order to be a safe side during this COVID-19 period. We are also required to develop system and procedures which help us to conduct financial transaction and reporting while we are working from home. And let us see the elements one by one. Yeah, the first element is a new costs. During this time, it is expected that new costs may arise in connection with COVID-19. So that it is very important to identify and plan these costs and check them against donor policies and procedures in order to make sure that they are allowable. In this case, we need to frequently communicate with donor in order to get approval, especially if these costs are material and not included in the approved budget. And also, we can also prepare additional mini budget to include items that help us to prevent COVID-19, and in this case, we are also required to communicate the donor if the material cost is, the item cost is material. In addition to this, we can also develop crisis management memo or policy to use this policy as a guideline to properly notify and seek approval from the donor. Okay, it is very clear that so many activities have been stopped at this time. This means that we could not use their corresponding budget as per our plan, so that it is very important to identify these activities and their corresponding budget to assess their impact on our program and planned target. In addition to this, we need to consider new additional activities that can be performed during this COVID-19 time, so that we can transfer budgets between these activities if you get approval from the donor side. In addition to this, if the nature of the program allow us, we can carry forward activities for the next period after we consulting our donors. Yeah, would you please move to the financial reserve part?
Oh, sorry, I went the wrong way.
The next slide, please. Yeah, when we talk about, when we talk about, would you please move to the financial reserve? Yes, thank you. When you talk about the financial reserve, in most cases, most NGOs do not have a financial reserve, but if they have, it is a very good opportunity to them to plan these financial reserves for emergency situation and for activities that listed in this slide. Yeah, the next topic is the review of cash flow. This is the very important topics because it is very important to review our cash flows at this special time. This is because if you expect an idle cash, we can just change or we can transfer this cash to for other activities, or if we expect a cash shortage during this time, we can delay activities which are not important for the time being. In addition to this, we can delay some payments by dealing with the vendors, and if possible, we can also negotiate overdraft facilities with our banks. Yeah, in this case, the IT and the electronic banking system are not well developed in our context, but there are so many possibilities for the finance personnel can be performed while they are working from home. For example, by obtaining a one-time password, the finance manager can directly deposit the salary payment into the employee's bank account without just sending a letter or check to the bank. In addition to this, our LIPs can use a cloud-based accounting software system. This means that they can enter the accounting information into this accounting software and other informations without just the need to present to office. In addition to this, we can also just make a payment to donors by consulting with the bankers. We can also just get an important documents, for example, bank reconciliation, as long as we have just authorization from our organization and from the bank. For this means that we don't need to just go to bank to get these documents. And finally, just to properly handle these time situations, our partners needs to just increase the benefit of just communication allowance to their employees. For example, in our cases, they can just provide CDMA or Wi-Fi service to their employees. It is available. In addition to that, they can increase their mobile and other communication allowances. Thank you very much.
Thank you, Fasike. Let's see, we have, the question is there a way for other agencies partners to share their own experiences and practices related to COVID-19 or capacity strengthening in this forum organized by ASAP? That's a great question, and yes, we have a presentation by FPD coming up next, and they will be sharing their presentation, their COVID-19 practices. And we have one that says, thank you for the presentation. I would like to echo the importance of supporting self-care. PAC's Columbia office has put together a WhatsApp group called PACT at Home that allows our staff across the country the opportunity to stay in touch and organize weekly classes where individual staff can lead a virtual class on a topic of their interest. We have found this to be a useful way to build camaraderie, learn about our colleagues' interests, and expertise outside of an office environment, and support each other during the national lockdown. Thank you. That is also a very valuable comment. I know at IntraHealth we have started similar groups, and we have a lot more staff meetings so that everybody's joining virtually, and we started to make them fun so that we do learn about each other more. That's it for the questions. I think we have a couple of raised hands. Samuel, I think if I can find you, you raised your hand. Samuel, I'm going to put you on to allow to talk. You raised your hand, and Mavis, since I didn't see a question, I'm going to allow you to talk after Samuel. Did that work?
Although
well,
Samuel is allowed to talk, he does still have to unmute himself. Go ahead, Samuel.
Okay, well, if that's not working, if I can encourage people to put their questions in the Q&A, we will answer them all. Last chance, Samuel. Okay, I'm going to stop sharing, and we're going to turn over to Suzanne Mabasso, who is working with FPD, and she's going to be presenting on what FPD has done in the response of COVID-19 and continuing operations. Over to you, Suzanne.
It says there. Can you see my slide clearly?
Very.
Excellent. Okay, thank you very much, Catherine, for this opportunity. And good afternoon, good morning, good evening to all the people dialing in from around the world. My name is Suzanne Mabasso. I work for an organization called FPD in South Africa, and we are a member of the ASAP consortium. Today, I'll just be sharing some of our experiences in South Africa in preparing for and navigating the national COVID lockdown, which South Africa is currently implementing both to flatten the curve, but also to buy the country time to prepare to respond to the epidemic. So whereas PAC's presentation really provided a very comprehensive overview of developing a business continuity plan, mine will focus more at the HR and administration components, and specifically some of the precautionary protocols that we've implemented in the workplace. So over the next 10 to 15 minutes, I'm going to share some of the practical steps that we did to really try to mitigate the risk of transmission in the workplace, and also to prepare our staff to be productive, to be motivated, and to be able to continue to work from home during the COVID pandemic in line with our business plans and in line with our organizational mission. So the structure of the presentation is a very quick introduction in terms of who we are and a quick summary of the COVID situation in South Africa for context. And then I'll spend most of the time really talking about the practical steps of what we did to try to mitigate the fallout of COVID for our employees, our clients, and well as considering how do we position FPD for sustainability after the lockdown. So FPD is an Indigenous South African organization. We are registered as a private higher education institution in South Africa and are very active in training healthcare professionals across the African continent, both face-to-face as well as via e-learning. Our main focus is on training, research, as well as a number of donor-funded system strengthening projects. We've been working with PEPFAR since 2005, and we also underwent the transition from being a sub underneath PACT to becoming a prime in 2007, where we also developed experience with managing subs. Currently, PEPFAR comprises about 21% of our organizational revenue. In terms of South Africa, this slide's a little bit old, but the first case was confirmed in South Africa on the 5th of March. It was imported from Italy. On the 15th of March, the president declared a state of disaster with travel restrictions. 3 days later, the schools closed. And a couple of days later, on the 26th of March, we started the national lockdown. It was initially proposed for 3 weeks. They announced a 2-week extension, so we are currently on week 4 of lockdown, of being inside our houses, some of us who are not having to provide essential services, with our children homeschooling in the background. We have just under 3,500 cases and 58 deaths. However, based on the criteria from the government, we don't anticipate easing on this lockdown in the near future. And I think just to highlight, it's about operating and doing business when there is high rates of uncertainty as to what next week or next month will hold. So now to the focus of this presentation, about really just sharing the practical discussions and steps we put in place at FPD to protect our employees, to protect our clients, but also to protect the organization. So when we started with the COVID planning, we chose to use a principled approach to planning and chose these 3 principles to decide our prioritization and our decision-making. So really applying the international recommendations for what we can do in the workplace to manage COVID. And then also using the decision matrix of making the decisions in the best interest of our staff and our clients, but also understanding that we as an organization have a commitment to our donors and to our clients to continue to deliver productively in line with our standards. So similar to what was presented by our colleagues at PACT, we created a COVID task team, which comprised of the various heads of departments or people responsible for specific portfolios such as travel and maintenance and facilities. And we worked together to develop a very practical plan for what we could do to make our work environment a safer environment. And over time, we recognized that most of our interventions fell in these 3 priority areas of what we can do to increase hygiene in the workplace, how we can limit physical interaction between people, and how we can foster social solidarity amongst employees. And we chose to encompass our plans and our communication within these 3 criteria because we thought it was helpful for our employees to remember what they had to do, and it was easy to communicate. We also did a lot of delegating of authority down to the department heads, specifically because they understood the nuance of their individual projects, the expectations of the donors or the sponsors, and gave them the mandate to go into their business plans, their work plans, their key performance indicators, and identify what needs to change and what can they do in this environment, what must they put on hold, and how do they convert their projects to be able to function in a virtual work environment. So just as a quick summary, these slides will be circulated. These were some of the steps we did at the workplace to increase hygiene. So we did training of all of our staff on COVID-19, the epidemiology, and how to control infection. We also did very targeted training of our cleaning staff, security, and reception staff, specifically on COVID and their roles and responsibility to help implement these criteria around infection control. And we involved them with updating the protocols. We had hand washing and soap in the bathrooms, but we installed hand sanitizer at all of the entrances to the various wings and the doors. And every vehicle and employee was issued with their own personal hand sanitizer. We worked with our the contracting organization who did the cleaning, about updating how frequently items were being cleaned, implementing protocols about cleaning meeting rooms after every single meeting, wiping down telephones and high touch surfaces. And we also took advantage of Google and all the beautiful and free IEC and infographics about COVID and put these throughout the building, circulated them to the employees just to get the information out to our staff. We also worked with our field staff who had to provide services in the community about ordering the appropriate masks for them to use. These are just some very practical pictures. If you look at the picture on the right with the door, we had the protocol to keep all doors open and put signage on the doors to remind about cough etiquette, put hand sanitizers upon the entrance and exits. In terms of our practical measures to limit physical interaction between people, we adopted a 1 meter rule. Since going on to lockdown, we've been informed that it's recommended to become a 2 meter rule. And that's about trying to make sure there is a minimum of a 1 to 2 meter distance between the employees in the workplace. And we also looked at interventions to limit contact between people. That was reducing the number of meetings we were having face-to-face, converting all meetings that we could into e-meetings, but also setting maximum capacity limits for the kitchen, for the bathroom, for the canteen, for the offices, just to limit the number of people physically present, but also to make sure we could comply with the 1 meter rule. We also put a very strong focus on preparing our staff and our projects for telecommuting and converting for a virtual office work. This included training our entire organization on how to work on MS Teams, and also taking the projects and setting them up to be implemented via MS Teams. And we went online and looked at our telecommuting agreement and adapted it to work in the COVID environment. And we looked at getting as many of our staff as possible out of the offices to get them to be productively working from home. This entailed developing very explicit telecommuting agreements that stipulated the times that they would be available, how they would be available, and what the expectations were in terms of deliverables, in terms of communication, in terms of participating in virtual meetings, and also updating the performance management structures and the team meeting structures to work in the virtual space. And I think this was one of the things that by the time the lockdown was announced, we probably had about 1/3 of our staff telecommuting. And as I mentioned, with the lockdown, our offices are closed and our business is being conducted virtually. This is just a picture of our boardroom. One of the interventions we did is we physically removed half the chairs in order to really make it difficult for people to sit next to each other. Another picture here is some of the open plan workspace, where when we had moved many of our staff to work virtually from home, we also blocked off certain desks in order to facilitate that 1 meter rule to make sure that people were not sitting close to one another. We also adopted and communicated a designated use rule, encouraging workers not to use other workers' stuff, such as staplers and telephones, and just sort of not touching other people's things. This is a picture of nice, pretty red X. This was the way we communicated the maximum occupancy levels. So saying no more than 2 people could be in the kitchen, #COVID-19. No more than 2 people at a time in the bathroom. And this was really to prevent people from congregating in small spaces. And the third and very important one, and this was mentioned, I think, in the chats and the comments before my presentation, is looking to foster social solidarity amongst our employees. So some of this was really making sure there was very clear communication and instructions to staff, that they knew what was happening and why things were happening. We were involving our staff with making choices in terms of how we converted into the virtual telecommuting environment. We did a lot of communicating HR policies, specifically sick leave, and really encouraging our staff to stay home and self-isolate if sick or exposed, and have a strong emphasis on communicating with their managers. We also put in a WhatsApp telephone chain, had a number of written communications from the MD, and I think we're having about every week or every other week an all company MS team meeting where the MD provides an update and people can ask questions about what's going to happen next. In addition to these all company activities, we have also worked with the heads of departments to set up very routine and structured virtual meetings with their staff, and increasing managers' focus on their employees and understanding ways to improve their engagement, and also being aware about mental health and stress reduction, and that we are implementing in a very uncertain and difficult time. So this here is just some of the things we've done at FPD to increase engagement. So some of the managers have morning huddles. These are 15-minute Teams meetings where everyone calls in just a quick check base, what happened yesterday, any update, but it also does some of that softer HR management where they engage and they joke. The pictures on the right show them when they had their homemade mask challenge and they had to wear their mask and they got to model it for their colleagues. We've also started a 1-hour MS Teams fitness training program where we get to log on and stretch and exercise and actually move. There are a couple of virtual journal clubs and book clubs that have started. And another point that's not quite related, but I put it here, is also keeping our staff motivated on achieving results and looking at the important but not urgent deliverables and people being aware that they are making progress and that they are being productive in line with the business plans and the missions. So the next 3 slides are included in the presentation. I will not be presenting them, but these will be circulated. These were some of the items that we addressed when we were developing our action plan to increase hygiene in the workplace. These were some of the actions that we put in place to limit the physical interaction between people in the workplace. And thirdly, these were some of the actions that we used to focus on increasing social solidarity amongst our employees. And so I think to conclude, I would like to thank you for your time, and I wish you all and us all the best as we navigate in these very uncertain times. And I found a very nice quote yesterday from Ed Catmull, who's the president of Pixar Animation, who created Toy Story and Finding Nemo. And I thought that suited the COVID environment perfectly, that not everything is simple, and to try to force it is to misrepresent reality. And I think we're all learning as we go along, and I think things will look up. Thank you.
Thank you, Suzanne. That was a lovely presentation. If people are following the chat, there's a lot of information in the chat. We will be typing up the chat and sending it out immediately after this so everybody can see what the Q&A is. In the Q&A block, we've also gotten a lot of emails. I have unmuted Doug Franke so he can provide some information about, from a compliance point of view, what to bear in mind during COVID-19. And while he's presenting, if there are any attendees who would like to raise their hand and share their experiences in business continuity with COVID-19, I will unmute you and we can have a discussion moving forward. Doug, are you ready?
Sure, thanks, Catherine. Hi, everybody. Yeah, as we've seen from all these presentations, these are unique times, but unfortunately, the compliance requirements, wearing the auditor hat here, which is never fun, but it's still going to apply. So I think I've typed in some of the comments, and I think it's very important that we do our best to continue to document everything. Now, from an audit point of view, from a USAID or GAGAS point of view, we don't need to see original documentation during the audit. I mean, hopefully this won't go on for more than a few months, but I would ask, even for monthly and continuation purposes, for a prime to review their subs, that you do get good scanned documents of whatever it is you're trying to document. I did mention that even though there is normally going to be annual audits for anyone who spends more than $750,000, there could, at the end of the project, which could be 5 years later, a closeout audit. And unfortunately, 5 years from now, people aren't necessarily going to remember all the challenges we're going through now and say, no, the rule says you need this, and you may not get this. So, and the other thing that I want, just a couple of things to highlight, I think it's important. We talked about a couple of times, Jennifer mentioned it, and our Ethiopian advisor mentioned timesheets. I want us to think, a timesheet normally is when people come to work at 8 and go home at 5 and they're physically there, but obviously we're not going to be doing that. So management might, in addition to whatever system you're going to use, management may wish to call every day and sort of document, what did we get done? because if you do have to, again, do something with your kids, or you got to be the at school, at home parent, I mean, you're still in theory expected to work 8 hours a day. So please document that. Also, there's two more things. Just take notes on the two areas you would want to be more aware of is the Section 2 Code of Federal Regulations 200.308. And what that is the revision of budget and program plans. We talked a lot about, yes, things will change, but a lot of that has to be documented. And I will say one thing, certainly if it requires agreement officer approval, that needs to be in writing. Now, of course, you're going to have discussions in your AOR. He or she will also be online. But at the end of the day, unfortunately, the auditor is going to say that needs to be in writing. So please, normally what happens is when you put the phone down or you finish the conversation, normally the recipient takes the responsibility to say, "Dear AO, during our discussion, we agreed this. Can you please approve this?" And I'm looking for the yes as the auditor. The other thing is just be aware at Section 407, that's under the cost principles, there's a whole checklist of about 26 things that need prior approval from your AO. And some of the things we talked about earlier aren't just programmatic approval, there could be other things. And the gray area that is, someone did ask the question about primes and subs. It is a gray area whether a prime can approve certain things that from USAID's point of view, they have to approve it at the prime. But then when you're talking about prime sub, can the prime approve that? So let's just assume, for careful sake, to be conservative, prime, I would certainly suggest if your sub asks you, can you approve something that certainly has to do with money, I would run that past your AOR and AO. Catherine, that's about all. I think some quick notes there about, unfortunately, the compliance side of life.
Okay, thank you very much. I don't see any hands raised at this time, and we have gotten a lot of email addresses from the Q&A, so we will add your name to our listserv, and you'll get invitations and presentations directly from us. And somebody said, please repeat the point on timesheets. I didn't get it clearly. So, okay, go ahead.
Well, I mean, normally we have, again, you would be in an office where, the auditor can see, well, we assume, and management can assume someone is physically there. That's presenteeism, absenteeism. Presenteeism is when you're there but not working. You're on your phone or something. But we certainly have no idea when people are at home if they are in fact working. So yes, you're going to put 8 hours on your timesheet, but it's between you and God. Are you really working? I think it's probably important in this case, depending on the company's policies, that if it's a policy for at the end of the period, either 2 weeks or a month, that the manager signs off that yes, the person actually did this. It wouldn't hurt to have a little bit more interaction about what you achieved today or what you tried to achieve. It's just for everyone to say, oh yeah, throughout the whole COVID X months, everyone worked 8 hours a day. Did they? I would just like to say let's see if we can get more. Maybe not necessarily formal documentation, like for 3 hours I did I changed the budget plan, or I worked with our implementing partner or our community workers, but a little bit more documentation of actually if you did interact and had program related activities, that would help. That's just further documentation to enable the auditor to say, okay, that time is good, those costs are okay.
Just to add to that, what IntraHealth has done is we've changed our work week. We used to be 40 hours a week from Monday to Friday, and now we are 40 hours a week from Monday to Sunday. So you can work on the weekend and put in hours to get to your 40 hours, and that's to accommodate people who have to do their homeschooling with their kids while working during Monday to Friday.
Yeah, that is fantastic, Catherine. I just want to add the caveat there. Be careful you're not breaking any country rules in terms of,
good point.
people are working Saturday time and a half, Sunday you get double time. I mean, you got to make it clear that IntraHealth probably, would have to say to people, you can spread your time, but you're not getting overtime or double time.
Correct. So we don't have any more questions. Debbie, would you like to add something?
Catherine,
Or Callie?
if Debbie's not
Sorry.
on, just
Go ahead, Callie.
sorry, Debbie. I would just draw all of the partners' attention to some of the links we've put in the chat. So especially important, there's a implementing partner call hosted by OHA tomorrow morning, or sorry, it's morning for us, but actually evening for most folks. I don't have, I think we don't have the link. Let me make sure we get all the contact info so partners can call into that, but that's a really important call. There'll be lots of technical information shared from SCAC, as well as a budget guidance and things like that. So I encourage partners to call into that. And then I've also put in the chat the links and dial-ins for the different partner solution calls, which Debbie mentioned. And these calls are, actually someone asked this earlier in the chat. These are partners sharing how they are adapting to COVID on different topic areas. So Friday, there is a call on facility-based staffing, and partners will be sharing how they've adapted to COVID on that topic, testing and linkage, and viral load and lab solutions. So a real opportunity to go a little more technical and hear from other partners on those calls. So we encourage you to also dial into those. Thank you, Lindsay, for adding the link to the IP call tomorrow.
Okay, and we will be typing up all these chats and sending them out later today. So everybody has these links. All the participants on the call will get an email with all of this information. And Freak Ray Keith is working on that, so expect an email from her. Okay, in closure, ASAP thanks you for participating. We encourage any feedback that you have. We appreciated the survey results that we got, and we have designed a series based on the topics you requested. And we are looking forward to further engagement. Please share the invitations widely and loop back to Grace Adwa for people that you want to have included in our listserv. USAID, any final words?
Just to thank everyone again for your participation, and there's ever-changing information and updates coming out, so please pay attention to those links and especially the SCAC guidance that's coming out, and please again participate in our upcoming call with partners tomorrow and our future webinars where we'll share more information. Thank you all for your active engagement and questions.
Okay, thank you all. Bye-bye. Stay safe and healthy.
Thank you, Catherine. Thank you, everyone.